Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today we're privileged to have Dr. McCabe Williams join us. She's going to be talking to us about disparities in the menopause transition. She's a board-certified obstetrician and gynecologist. She's a vice chair of professional development and wellness in the Department of Obstetrics and Gynecology at Washington University School of Medicine in St. Louis, Missouri, where she established the Menopause Medicine Program. Welcome.
Thank you so much for having me.
So I want our women who are with us, who are at that age and stage and going through some of the reproductive and perimenopause and menopausal transitions, to really begin to think about whether or not, as women who are in different racial and ethnic groups, whether or not that contributes to the possibility of disparities in their menopausal experience.
What we have learned from our research is that there are some things that are very common to each menopausal woman's experience, and yet we in different racial and ethnic groups can have a very individualized and unique menopausal experience because we come from different cultures, we have different identities that impact the way in which our bodies are functioning and how our bodies are changing as we go through menopause. So it's important, I think, to recognize that we are all different. There are some similarities, but there are differences in how we will individually experience menopause, and that is okay.
So when we talk about looking at different experiences from racial or ethnic differences, what do we bring to the table that might be somewhat different, that is going to overlie or influence the interpretation of symptoms or the experience of symptoms?
So let's talk about what might influence the experience. So, a number of things that about our culture may influence experience, how we talk about menopause with our family, with our friends, or whether or not we even talk about it. In many African American communities, we just don't talk about these symptoms because we've minimized them. They're just not as important, perhaps, as other things that we may be facing as caregivers, as people, professionals, or the discrimination that so many African American women may face. So that may provide some context and our prioritization of what is important for us in terms of health. So if we are not having the conversations external to exam rooms and providing importance to these symptoms, then African American women may be less likely to raise their symptoms with their clinicians. And so what are those symptoms that can be very impactful? Well, we know that African American women will have longer hot flashes and night sweats, that they will experience them more frequently and severely. African American women may experience hot flashes and night sweats for 10 years compared to white women, and yet they may not raise that concern when they see a healthcare provider. The other piece of this is because of various factors, healthcare providers may not ask or inquire about a woman's symptoms. So it is important that you are aware that there is this difference in how these symptoms are experienced, how long they're experienced, and that you advocate for yourself and ask questions about what is this whole thing about menopause and how I might be experiencing that differently.
So here we're moving not only from the generalized talk of health inequities in general, but health inequities specifically in menopause and what contributes to those health inequities specifically in menopause.
So the health inequities can be a result of a number of different factors. We often will talk about this term that's called the social determinants of health. And that is like where you work, where you live, where you play, your ability to have access to high quality healthcare, your background in terms of your educational, your economic, your financial situation. Those things, among others, may play out in how you are treated in the menopausal time period in your life. I always like to point out to my patients that you're going to spend a half to a third of your life in menopause, and that this is a really important time to think about your overall health. This isn't just about hot flashes and night sweats. It's not just about a time period, but really, how can we optimize the health of women throughout this time period? And unfortunately, many women of color start the menopausal transition or that perimenopause having already faced many negative life experiences and coming to this with increased risk of high blood pressure, diabetes, arthritis, and a number of other health conditions which impact this overall experience in the latter half or the latter third of life.
So there's recently been a lot in the lay press about menopause, and sort of you hear this expression, menopause is having a moment. It's more than a moment. But if we look at that in terms of, some increased public awareness of the fact that menopause is something that we need to be talking about, how has our understanding of menopause in different groups then evolved over time?
Well, we are learning a little bit more, and our research that we recently published has revealed that menopause is not universal. So we're learning a little bit more about how African American women, Asian women, Hispanic women may be experiencing menopause differently than white women. In general, I'm glad that there is increased attention to menopause, because women in general in this period of life have been neglected from research, neglected from care and treatment overall. And so with that, we even have populations that we know less about. My hope is that with this increased attention in this moment, if you will, that our research, our knowledge base about how all women and women of color and women of different racial and ethnic groups will also expand.
And then the question about treatment itself. Are there differences in the types of treatments that are offered and received between these populations that do and do not experience disparities?
Yeah, so we, as I said earlier, we know that African American women will have more hot flashes and night sweats, and yet they're half as likely to be treated for these symptoms. And it is important to note that we don't know exactly why they are less likely to be treated. It could be because, many African American women or other women of color may have some resistance to perhaps hormone therapy, and maybe they are seeking natural treatments. And it is important for healthcare providers like myself and others to explain that we have a whole range of treatment options, and to appreciate and understand why women may be less likely to take certain treatments and how they feel about certain treatments. So I think it's important for our patients to come to this conversation with an open mind that there are a variety of treatments available, and to engage with your healthcare provider to see what is right for you. There's not one size fits all treatment. And yet it is important to know that there are many treatments available, and there's no need to suffer through this transition if you want to be treated.
I think, what I'm hearing you say for women who experience these symptoms, that it's important to advocate for yourself. And advocate may simply be bringing an awareness to your healthcare practitioner that the symptoms exist, and to also recognize that this is an ongoing conversation. That if there is a no the first time in terms of treatment options, that this is not a conversation that's enclosed. And I would encourage women to continue the discussion, recognizing that treatment choices, treatment opportunities may change over time, and that we really have to keep an open mind as well, you as a provider and our patients who come to providers, to be educated and really understand what is being offered for them.
Self-advocacy is what I certainly promote. If you are not asked, don't hesitate to tell and bring it up. I think there are tremendous resources, things from the North American Menopause Society that can help us understand what is going on with our bodies and arms us with information so that when we do have that opportunity to have a conversation, that we prioritize that our menopausal health, our menopausal symptoms, and that we get the treatment that we need. And of course, if you're not responded to as you would hope the first time, keep asking those questions.
Well, thank you so much for joining us and really encouraging our women to do self-advocacy and to make sure that conversation is going forward and that their symptoms are being heard. Thank you so much for joining us.
Thank you for having me.